This is what it looks like when you breathe 40 times a minute, have an oxygen level that's dipping well below 80. This is what it's going to look like. I hope that the last moments of your life don't look like this. Because this is what you'll see at the end of your life if we don't start wearing masks when we're out in public. When we don't practice social distancing. When we don't wash our hands frequently. Because I promise you, this will be what you see. I promise you, this is what your mother or your father or your children, when they get COVID disease, will see at the end of their life. This is serious. I beg you, please practice the precautions to reduce transmission of COVID disease so that we can effectively prevent disease for you and your loved ones.
The next chapter is going to be vaccine distribution and vaccine acceptance. This is the weapon that wins the COVID war, and we have to get serious about this. The distribution is a massive undertaking by government. I've said a number of times, it has to be fair, it has to be equitable. The state has to have funding to do it. We have to be able to get the black and brown communities and poor communities. Blacks died at twice the rate that whites died. Browns died at 1.5 times the rate that whites died. They've had less COVID testing. They have higher infection rates. There is no justification not to have a very aggressive outreach program for the black and brown community. But government is going to have to do its part. People are also going to have to do their part. They're going to have to accept this vaccine. And right now, all the current data suggests people are very skeptical about the vaccine. And the estimates are you need about 75% of the population to be vaccinated for it to be effective. And you have 50% of the population roughly saying they're not going to take the vaccine. Mathematically, that doesn't work. You can't get to 75% if 50% say they aren't going to take it. But this is here and now. This vaccine distribution is going to happen in the next couple of weeks. New York State is going to be very aggressive about the distribution. I believe there's a great advantage to the state that most effectively vaccinates all people, and we'll be reaching out and educating people in the state. I would never ask anyone in the state to take a vaccine that I was unwilling to take myself. That's always been my standard. I'm not asking you to send your child to school if I wouldn't send my child to school. I'm not asking you to put yourself in a situation that I wouldn't put myself, and I won't ask New Yorkers to take a vaccine that I wouldn't take myself. But it is real, and we need people to start to focus on it because we want to get it done very quickly, and I want New Yorkers to start to think about it seriously. We're not going to get to the general population for a while, but you will start with not-for nursing home distribution. So you'll have parents asking their family, what do you think? Should I take it or not? You'll have healthcare staff having to decide whether or not they take it. And people should start focusing on it because it's real and it's here. And again, New York wants to do it as quickly as we can. Just to show you how real it is, in this box, what is in this box? Maybe it's a Christmas present. Who would I give a Christmas present to at this point? Let's not ask. This is a box of vaccines. Pfizer, which is a great New York company, made the vaccine. Pfizer developed the vaccine without any assistance from the federal government. They did it all on their own. And we're very proud to call them a New York company. But it's a the vaccine process is a complicated process, and the distribution is going to take a lot of work and a lot of effort. The package itself comes with a geo-tracker GPS tracking device that can track the program, and a thermal monitor, so it monitors the temperature of the package. You want to know where the package is, and the package has to stay at the right temperature, because if it doesn't, then the vaccine is destroyed. It comes wrapped in dry ice. The dry ice, because it has to be ultra cold, when you receive the package, you have to replace the dry ice, and then you have to replace the dry ice every 5 days, okay? Under the dry ice is the actual package that has the trays in it. The trays have the actual vials in it. A vial, by the way, the vials are made glass from Corning Glass, another great New York company. A vial contains enough for 5 dosages. The vial comes with a diluting liquid, and the actual vial gets diluted before the vaccination actually happens. One tray, they call this a tray, one tray can hold up to 195 vials. Each vial, this is a vial, can do 5 dosages. The dosage, and then administer the dosage within 6 hours thereafter. And that's one dosage. Second dosage is 21 days later, and the person is not, the vaccine really isn't effective until after the second dosage. So it's not easy, but it's real, and they're being manufactured, and they're going to be shipped. And we're very proud of Pfizer, and we're proud of Corning. And we are working very hard to be ready for the distribution and training people on the distribution to make sure it's all done correctly. But this is the weapon that is going to win the war.
But we also said at the time that we would set a strict standard and we would live by it. And if we hit 3%, we'd have to reevaluate the whole situation. We did, of course, hit 3%. We did a temporary closure of our schools. And then we went about the work immediately of resetting the entire equation and trying to determine a path that would be sustainable. Regardless of the challenges we faced, we needed something sustainable that could link us up to the time when we would have the vaccine widely distributed. And so we focused on increasing the health and safety measures, doubling down on the things that work, making them even more stringent and exacting. Had conversations with our stakeholders, conversations with the state. I've had a number of conversations with the governor. We've been working through how do we take all those good lessons of health and safety and amplify them with new measures. So that is exactly what we now will put in place. We will have testing that is going to go from monthly in every school to weekly in every school. We will have consent forms required for attendance. I want to emphasize this. Students will not be able to attend school unless they have a consent form on record, period. This is something for everyone's health and safety. And as we open school in phases, and I'll go over the phases in a moment, wherever possible, we will, in schools that have the ability, go to 5-day-a-week instruction. Now, this is for the students who already were in blended learning or the ones who opted in recently. For any school that does have the space and the ability to move to 5-day-a-week in-person instruction for those kids, that will now be the preferred model. So we'll have in-person instruction for those who are part of that approach, remote for all other kids. The Situation Room will also, of course, continue to do its extraordinary work, and this has been one of the big X factors. The Situation Room has allowed us to keep each individual school safe with very exacting follow-through on every reported case and quick action to address what the ramifications of the case would be, whether it means in some cases the classroom needs to be closed for a period of time or even a whole school. That approach has worked. That will stay strong. Obviously, all the social distancing rules, mask wearing, everything that's worked before, but with these new measures. So that is the basic approach, and now here's the important news. Beginning the week of Monday, December 7th, New York City public schools will begin to reopen. We will begin with elementary schools, K to 5, and our pre-K, 3K public school centers. And then later that week, on Thursday, December 10th, our District 75 special education programs. So New York City public schools will be reopening in phases starting on Monday, December 7th. Now, we are focusing on the younger grades. Let's be clear. Focusing on the younger grades on that Monday, all K to 5 programs, whether they're standalone or part of a bigger school, those grades will come back, and those pre-K, 3K centers. Why? Because we know, first of all, studies consistently show that younger kids are having less of a negative experience, and there's less concern about the spread when it comes to younger kids. Also, the demands that our parents are going through, and I feel for all our parents who are experiencing so many challenges right now, how important it is for them to have their younger kids in school, how important it is at that age, both educationally and socially, but also in terms of how parents juggle all the challenges in their life. And then District 75. We have a little bit of extra work to do to get District 75 programs back up and running, but as I said, Thursday, December 10th. District 75 school special needs programs, so crucial. We want to be there for those kids and their families that go through so much. We've heard from those families, they need this back, so we will get that up and running. Now that's going to be the vast majority of the city. Those levels we're going to address in the future of middle school and high school, but we're not ready for those yet. That's just the plain truth. We will.
This is what it looks like when you breathe 40 times a minute, have an oxygen level that's dipping well below 80. This is what it's going to look like. I hope that the last moments of your life don't look like this. Because this is what you'll see at the end of your life if we don't start wearing masks when we're out in public. When we don't practice social distancing. When we don't wash our hands frequently. Because I promise you, this will be what you see. I promise you, this is what your mother or your father or your children, when they get COVID disease, will see at the end of their life. This is serious. I beg you, please practice the precautions to reduce transmission of COVID disease so that we can effectively prevent disease for you and your loved ones.